Hi, so my name is Yasmin Razak. I'm a full-time GP and I run a training hub, and I work in West London. And that really resonates with me, the previous question. And I think the report's essential. And I think what really stood out for me was the evidence, the data of the community approach that we take, and the essence of what primary care is, what primary care does, which is human relationships, which we can't measure as a KPI. And so we're just looking at the wrong outcomes constantly. And I'm in Northwest London, and the current plan, without patient consultation or without GP consultation, because I hear the voice that maybe GPs are hard to engage, and so it's been decided not to engage them, is to actually remove GPs from the front line now. And GPs will only deal with complex care, and all of the ARS staff that we have trained and supervised and brought in to support our patients in a holistic manner will be also removed, but in a hub setting at scale. And a care coordinator will triage them, but won't know the patient and won't be clinical. And our pharmacists and physios who aren't used to diagnostics, that actually aren't trained for that, will now have to do diagnoses, referrals, assessment, 2-week waits, and refer back to us. So this is a whole-scale change of primary care happening in an ICS here and now, and we understand that we might be a demonstrator site before it goes national. So I think the on-the-ground reality of what's happening is so divorced from the official policies and the lines that we hear, and without patient and public involvement, without asking people who do the job every day, we're really at risk, a current risk of actually breaking up our essential, what the essence is of the NHS, which is primary care. And we know 7% of consultation, 7% of funding comes from 90% of consultations and activity. And the question, I guess, is how do we utilise the think tank's amazing understanding, knowledge, evidences, and everything that we know to actually influence what really happens in these ICSs and in some back office meeting in NHSE, which has not been shared or documented? And how do we really make that shift happen? Because it's critical, it's happening now. We are just about to lose primary care in North West London.